So for many with bleeding disorders, not all, but for many, the impact on learning is really intermittent and inconsistent. So much of the time your kid is doing fine, but then they might have a joint bleed in their wrist or their elbow in their dominant hand. And all of a sudden it's very hard to take notes. It's very hard to type. It's very hard to carry their backpack around because of that. It's very hard, I think, for schools. Schools are really set up to deal with things that are pretty static. Like, a kid has dyslexia, they have difficulty learning to read. That is not going to be up and down week by week. It's really going to be pretty consistent throughout their development, hopefully on the upward trajectory for those kids. For kids with bleeding disorders, it might be really intermittent. And so it is a little bit more challenging because schools are just not set up in a way to have plans to do that. So in that case, that's why you want to be kind of thinking about, well, my kid might be doing fine now, but they might not be doing so fine. And if they do get a joint bleed in their wrist or their elbow or their knee, that we need to have those accommodations in the 504, because 504s are typically only reviewed once a year. So you want to be thinking about not just the best case scenario, but kind of the worst case scenario for your kids functioning. The other thing to mention is that a lot of kids have attention problems because pain is very distracting. So hopefully our kids' pain is being managed really well, but sometimes we have some breakthrough pain. Sometimes it's hard situations. Also, due to bleeding disorder, you might miss school, and that in itself can cause an educational delay. And finally, this is rare, but I did work in pediatric stroke during my internship and fellowship and my first job at the Children's Hospital in Philadelphia. And we did see brain bleeds. They were rare, but they do occur. And of course, in that situation, they can impact a child's learning. Okay, so one of the things I want to encourage, I'm gonna see if I can just adjust this a little bit, maybe. So it's all in the window. I think, and particularly, this is how I feel about my own child. On a day-to-day basis, I do not see my child as having a disability, but she does have a disability every single day. She cannot eat like normal kids can, ever. And for you guys, there is, even though there might be days that your kid's doing incredibly well, there's any day it could be true that they could get a joint bleed. And so it's something to think about. That when you are working with a school, you kind of have to embrace that disability word. And really, we have to think about it a little bit differently. A disability describes any ongoing physical or mental challenge. ADA says that if there is a physical or mental impairment that substantially limits one or more major life activities, and those activities include things like breathing, walking, eating. In this case, circulation is impacted. Has a record of such impairment, meaning that you don't have to currently have that impairment, but you just have to have a history of having that. Or other people think that you have that impairment, which I think is an interesting qualification. So when you put it in that terms, 20% of Americans qualify as having some sort of disability. And just because someone has a disability doesn't mean that they're not capable or that they are disabled at all points in time. It might just mean that they need accommodations in order to have the same opportunities that everyone else does. So you really do need to lean on that disability word when you're working with the schools, because if you don't have a disability, the school isn't required to help you. So a lot of the times what I've seen is I've seen parents really have a hard time using that word and saying that word. And that gives kind of the school an excuse sometimes to not provide them with accommodations or specially designed instruction. So we do have to claim that for our kids. We have to claim it though, and not give it more space than it necessarily needs to have. It just means that there's some limit in a major life activity. It doesn't mean that the child is not capable. Does that make sense? Okay, so there are three major types of special education plans: an individual health plan, a 504 plan, and an individual education program or an IEP. And we're going to talk about what all of those mean. So federal law states that all children have a right to a free and appropriate education at the public expense. That is called FAPE. That is a law that protects you. So all children should be able to get a free and appropriate public education. It has to be appropriate for them, of course. Okay, so what an individual health plan is, it's a plan of triage in healthcare often developed by a school nurse. It includes step-by-step instructions of care, and it's really designed for children who may require a health service every day or those with chronic conditions. So for example, if you have a child with a food allergy, they're allergic to peanuts, say. So the individual health plan would not say anything about the child cannot be in the same room as peanuts, isn't allowed to touch peanuts, peanuts are not allowed to be used. The individual health plan says, if child exposed to peanuts, this is what you do. Step one, you do this. Maybe you administer Benadryl and call the parents. Step two, you administer the EpiPen if symptoms persist. It's really a triage nursing care plan. And that can be really helpful for a lot of kids with bleeding disorders. But the Hemophilia Federation of America, HFA, says they want you to have a 504 plan, and here is why. So 504 plan is based on Section 504 of the Rehabilitation Act, which is a civil rights law, and it prohibits discrimination based on mental or physical disability. The goal is to level the playing field for the child, not to give them extra help, extra support, just to make things equal to every other kid in the classroom. So you get under a 504, you get accommodations, not specially designed instruction. There's no learning goals with a 504 plan. 504 plan is things like, special direction in PE or being allowed to miss PE if there is a bleed at that time. Accommodations don't change what the kids learn, just how they learn it. So if every child is being asked to participate in some sort of PE activity that your child's not safe for your child to participate in, it just means that they can do a different activity instead. The goal is really to remove barriers and make sure all kids have access to learning. In order to get a 504 plan, you need to prove that the child has a disability in a major life activity. And Congress actually provided a very, very long list of examples of major bodily functions that are major life activities, and that includes circulatory functioning. So every kid with a bleeding disorder should qualify under number one. Number two, that disability must impact access to the curriculum, meaning that there are some things that other kids might be doing at school that are not safe for your child to be doing at school. And it also provides a greater level of supervision, for example, allowing the child to go to the nurse when they say that they need to, or checking in with the child for pain. So the HFA says that this is probably the right fit in terms of a special education plan for a kid with a bleeding disorder, unless the kid is also having other educational problems, and we'll talk about that. So here's some examples of things that would be accommodations in 504 that you could not get with an individual health plan, okay? Well, the first one you probably could get with an individual health plan, but it's different. So if an injury is observed, reported, or is there a bleeding concern, the student will immediately be sent directly to the nurse accompanied with supervision. Okay, so that maybe is something that you could get with a IHP, but possibly not. If a parent or a medical provider asks for physical restrictions, the school will abide. So meaning if your child's okay to participate in PE or recess on a normal basis, that's great. But if a bleed in a joint happens and they can't do it for a while, all you need to do is ask and they will move you out of there. And that's what's important. This is a big one for parents of young kids. I know that when you first send your child from, kind of a small preschool into that big elementary school into the kindergarten year, it is very, it's anxiety provoking. So, and particularly when the idea of them going on field trips and being away from, being in a different environment. So parents will be permitted to attend all field trips. If the parent is unable to attend, the school nurse can attend in his or her place. That's a big one and a really good one. Advance notice of activities in PE, meaning if you're switching to something that you're not comfortable or your child's doctor's not comfortable with during PE, you'll know what it is and you can provide an alternate activity. Alternate activities will be provided if there's a bleeding issue and the child can't participate in recess. Medications and supplies can be stored in the nurse's office with correct documentation from the student's medical provider. This is the one that we're talking about right now is absences. This is the one that really separates the individual health plan from the 504. This is something you cannot get in an individual health plan. And I think it's a really important thing to have in there. Absences due to a bleeding related disorder will be excused. Classworks and all assessments can be completed for full credit. And that is one that I also have something in my daughter's 504 about if she has, so, you know, if she has exposure to gluten, if she accidentally ingests gluten and she will get sick for a period of weeks, that she cannot participate in the high stakes testing during that time. She will be allowed to recover and then she can do the high stakes testing. I don't want there to be a situation in which, you know, end of year exams or something like that, and she gets glutened right before, and so she can't do her best on those exams and it affects her life. And that I think is a good one for a kid with a bleeding disorder as well. Parents, doctor, or nurse can provide a staff educational training about their child's condition to all school personnel. I think that's a great one. And then once you move into middle and high school, extended time between classes, pass or a key to the elevator if you're in a big school with a lot of stairs. Copy of the class notes provided by the teacher in the event of a bleeding issue. Extra sets of textbooks for home use. In this age of digital, it might not be as important, but maybe an extra laptop so that the child doesn't have to schlep the laptop between home and school, but can have a laptop for home and a laptop at school. Extended time for classworks, homeworks, or assignments, and an extra locker or a lower locker so that you're not having to reach above your head for books. All right, so the IEP is the next level up. So we have the individual healthcare plan, which really just provides like triage. Then we have the 504, which provides accommodations. And then the IEP is the highest level of special education plan. And the law that created the IEP is the Individuals with Disabilities in Education Act. So that is supposed to not just take kids and put them on the same playing field as each other, but if you are falling behind in school, then they have an obligation to help you figure out why and to help catch you up. So in addition to accommodations, you get something called specially designed instruction. So for example, if your kid with a bleeding disorder has missed an awful lot of school, say like 3 months of school, you'll get that extra time and extra instruction in order to help your child catch up. Now, many times, because this is how it works, you sometimes have kids who have other common learning challenges as well as a bleeding disorder, such as maybe ADHD, such as a learning disability. They might get an IEP for the academic problems that are due to those conditions. And then you can write they will get specially designed instruction in their IEP, such as therapies, or special classwork with a special education teacher, like 1 period a day, or being pulled out for a segment of a day, or having a teacher pushed into their class. But you can also get accommodations as part of the IEP, and that's where you can put your accommodations related to your bleeding disorder. So if you have an IEP, you don't also need a 504, although you can do that. Schools just tend to not like to do that because it's a little bit more paperwork, but you can get everything you need under the IEP. So the IEP trumps the 504, the 504 trumps the health plan. To qualify, the school needs 2 things. They must determine if your child has a covered disability. In the case of if your child has missed a great amount of school due to their bleeding disorder, they might be falling behind educationally. That special education category would be called other health impaired. Second, they have to determine if it's severe enough to need specially designed instruction and related services. So unfortunately, just having ADHD, for example, does not qualify you for having an IEP. You have to show that the ADHD has caused the child to be behind in school. So you actually have to be behind academically, grades or test scores, something has to show that the child is behind in order for them to get an IEP. The diagnosis itself is not enough. Diagnosis plus functional impairment. Okay, so now we're going to talk about how to start off. So imagine that you do not have a 504 for your child. You don't think you need an IEP. You just want to get a 504 for the bleeding disorder. So to start the process, you would write a letter to the principal of your school. If you happen to know the name of the special education coordinator or the staffing specialist, you can include that person, but you do not have to. The principal will probably forward it along to the correct person. You should have a diagnosis letter from your hematologist. I think that's a very important thing to have. You can also, and I'm going to show you some of the links in here, links to some of the HFA materials. And in your email, You want to explain how your child's disability impacts his or her access to the curriculum. Those are the magic words. So you need to say, because of my child's bleeding disorder, he will require accommodations in order to have access to the curriculum. And we would like to request a 504 plan. When you get the meeting, which hopefully you will all get the meeting based on that letter and the diagnosis letter and some of the HFA materials, ask for the teacher to be there. The special education coordinator, or sometimes they're called staffing specialists, will be there, and ask for the nurse to be present as well. So the parents will, you as a parent will need to be responsible for educating the school staff on bleeding disorders. It's safe to assume that they're not going to know a lot. This can be very hard because I'm sure you have a lot to say. I know when I go into that meeting, and I have my meeting for my daughter on Monday, I want them to know everything, but but you really are going to have 5 to 10 minutes to give them the information that you need them to know. And so you want to think about like bullet points, like what is it that I need them to know about bleeding disorders, and what is it that I need them to know about my child in particular. And then I think this is very important, especially as kids get older. You also want to talk about the emotional impact of having an invisible illness. What has this been for your child psychologically? How has your child been coping with having a bleeding disorder? What are their strengths? What is something that they're still working on? Are they having a lot of anxiety? Have they learned how capable they are? Whatever it is, you want to talk about the emotional impact that's happening. When you get to that meeting, it feels a little bit like you're outnumbered. So in this cartoon, it says, if you have all these people on this side of the table who are all from the school, and then they say, I'm not sure why this parent always feels compelled to bring an advocate to the IEP meeting. Well, because you are in there, and then there's all these people on the other side of the table. So you definitely can do that. If you are having any pushback or you're having any problems with it, you are allowed to bring whoever you want to bring. You get to, when you sign the form, you get to say, I will be bringing so-and-so. You can bring a friend. You can bring your spouse. You can bring an advocate. So there are often advocates for hire who will help come with you to the meeting to help advocate for you. They're very experienced with it and can be very, very helpful. And then, the joke is, this is what it feels like after an IEP meeting. It is very overwhelming. You're talking about something incredibly personal to yourself. It's your child, it's your health, it's their health, it's their education. And you're feeling very emotional about this whole thing. And even if they're doing well, it can still just be a really emotional and draining process, even if everything goes well. So here are some of the HFA resources, which I think are really fantastic. And these are things that you can print out from the HFA website. So oftentimes, in terms of educating the school and the teachers, pictures are worth 1,000 words. So you can talk and talk and talk, but it's really helpful for them to understand what this is like for you, kind of understand the medical background in as simple of a way as possible. And really for them to understand, it's really good that the HFA has things like symptoms of a bleed. This is what it feels like. This is what you need to watch out for. Okay, so, and then we're talking about invisible illness. So there has actually been some research that has shown that your illness, if you are physically disabled, such as if you are in a wheelchair, people expect a lot less of you than if you have some sort of like chronic pain disorder, for example, or some sort of invisible illness. But actually the opposite might be true. People who are in wheelchairs are usually very capable and independent. And someone who has like a very severe case of lupus, for example, really might not be as functional as someone who is in a wheelchair. We tend to have a bias towards what we can see. We believe it's true if we can see it. If we can't see it, we don't tend to believe that it's real. And there's a lot of, well, this is mental. You should just be positive about this. And so there's kind of an attitude of just, come on, get over it for invisible illnesses. So you have to advocate and say, no, this is real. This is important. I need you guys to take this seriously and accommodate appropriately. but also you have to watch out for making sure that your child doesn't use that as an excuse, and that you don't use that as an excuse for not allowing them to continue to achieve age appropriate milestones for independence. So we all have to push our kids. We all have to allow them to do things that feel a little out of our comfort zone. And that's part of parenting, and part of parenting a child with a medical illness as well. So over time, you have to transfer that also to your child. So as your child gets older and more independent, you need to they need to advocate for, this is how I need to be accommodated, but also I can push through this and I can make this work and I can plan for this. Now, one thing that's important is that you do have a right to not disclose your child's medical condition. And for example, in order to get the 504 plan, you probably do need to disclose it to school staff and school personnel. But you can have in the 504 that you would like the teacher to not disclose it to the other students. That is absolutely within your rights to do, and it might be a good thing in some particular cases. In general, it does go better when you disclose the information to the teacher and administration, and it goes better when the child discloses it to their peers as appropriate, as the child is comfortable with it. It can be an issue to have the teachers or nurses believing children. Kids will use, excuses, health excuses to get out of things. So since some kids do that, they sometimes assume that everybody is doing that. And that's not the case for your kids. So it's good to disclose to the people who need to know, but you don't need to have it be more than that. I love this. Please tell me what does sick look like. I'll make sure to try to get it right next time. And then that's why you guys so parents who have invisible special needs often feel isolated, judged, frustrated until they meet other parents sharing a similar journey. And that is why it's so fantastic that you guys have such strong networks and such strong programming and such help for each other, because you need to work together both to process your emotions around having this journey, and for your kids to have peers who they can relate to, and just to understand, understand one another and have that support of that community. So I do think it's really important that you talk to the teachers in your 504 meeting about the emotional impact. So you're going to have some teachers who are going to want to treat your child like a paper doll, not let your child do anything because they're so concerned about it. And you want to, let them know what your attitude is, what you feel comfortable with. Like, focus a lot on, I feel comfortable with this. If you don't feel comfortable, or your doctor doesn't feel comfortable with your child swinging on the monkey bars, then you need to say, I want you to, limit that activity at recess. But instead of saying don't swing on the monkey bars, say, can you go down the slide, please? That's a safe activity for you. You want to phrase it as punishment. Avoid saying what the child cannot do. Phrase it in a positive way. I want you to do this. How about you play with this? Stay on the ground, please, if that's what you need to say. Also, it's very important for teachers to not say this, and for parents to not say this. If you keep doing X, if you keep swinging on the monkey bars, I'm going to have to send you to the nurse. We don't ever want to phrase going to the nurse as punishment. Even if everything goes right, the odds are that your child is going to need to go to the nurse at some point. We want to have that be considered a positive experience. So, you say something different instead of, okay, let me know, do you feel like you need to go to the nurse? Do you want to go see Miss So-and-so? I'm sure she's got some stuff that will make you feel better. Do you need to go there now? Another thing is that school age, some children avoid reporting pain or bleeds. They just want to fit in. They want to be normal. They just want to go on to the next activity. It's important for everybody, all the adults around the child, to remain calm and reassure the child that the right thing to do is to report the bleed, report any pain that they're having. You have to make sure that then you don't have a huge reaction when your child reports a bleed, because having a huge reaction to the reporting of a bleed will guarantee one of two things. The child will start reporting lots of pain to you, or the child will start underreporting pain to you because they didn't like it. So they either really liked it, they made a big splash in your emotions and like, oh, that was fun, I made mom react. Or it's like, oh no, I didn't get to go do the thing I want to do, so I'm not going to say it. And children, young children especially, are not, and to be honest, teenagers are not rational about these things. They, it really is part of how child brain development happens, is they're not necessarily going to be rational in how they do things. So you want to keep the emotion low around the reporting of a bleed, and you'll be more likely to get accurate reporting. Okay, so teachers also need to understand the emotional impact. So we talked a little bit about kids. Now for teenagers, the primary developmental goal of a teenager is to separate from their parents and create their own identity and their own social group. They want to fit in. They do not experience fear the same way that either young children or adults do. It has to do with brain development. And they really are not nearly as scared as maybe they should be during this age period of brain development. There's actually evidence that they do not identify fear in themselves or others very well. And it's important about the teachers, the nurse, the school staff should not disclose to peers without permission, but it's really great if your teen can disclose on his or her own at the time that feels right for them, because it will be much more positive of an experience if their friends know about it. It's not something that you want to keep hidden, but it's also not something that everybody needs to know, just the friends who you trust. Okay, so this is nice. I'm gonna see if I can make this a little bit bigger, a little easier to read, hopefully. Okay, so this is a really nice handout from HFA that kind of just lets you know what is the right special education plan for your child. So the top question is, does the bleeding disorder limit any major life activities at this time? Okay, no, but bleeding disorders are unpredictable. They can limit a major life activity at any time. So the recommendation of the HFA is that every child get a 504 plan in place so that you have it if and when you need it. Now the next question is, has the bleeding disorder caused an educational delay? If the answer is no, my child's doing fine in school, then probably the 504 is the right way to go. If the bleeding disorder has caused an educational problem, difficulties with learning, something along those lines, then you probably want to look at an IEP. Okay, and the IEP process is pretty lengthy. The 504 process is a bit shorter. If you feel like you need to, you can always start with a 504 and then get the IEP added later so that your child does not have lack of a special education plan and the appropriate accommodations at any point. All right. Another thing that's really great to think about is what are the responsibilities of the student, the parent, and the school as you work together to create this plan. The student, as age appropriate and developmentally appropriate, should learn to communicate, particularly if they have any pain. Tell somebody when they're bleeding. They still have to do all their schoolwork. Bleeding disorder is not a reason to get out of learning your math facts. Make the same amount of effort as someone who does not have a bleeding disorder. The parent, it is important that they take on the responsibility of communicating their child's condition, activity level, and current treatment. Help obtain makeup work if your child's missing school. Help the child have a positive attitude about school, and work with the school staff and the nurse to develop a factor treatment plan, if that's appropriate for your child. The school's job is to monitor the student achievement and inform the parents if they're noticing any changes in their child's attitude or performance, academics, whatever. Communicate to the parent or child any observable sign of a bleed. Stress the importance of completing assignments and promote ability and success, not inability. All right, so we're gonna talk a little bit about the pandemic now and virtual learning. So I know that probably most people are gonna be going back to school pretty soon, and most learning is gonna be in person. But of course, it is very challenging. I'm sure you experienced some at-home learning last year, if not all year. And then there's always a possibility of quarantine. So I'm not sure our days of virtual learning are completely behind us. The good news about your child being home, if they've had to be home educationally, is that accommodations for bleeding disorders are really easy to do at home. You can sometimes move at a faster pace to make up for lost time. It's easier to allow frequent breaks, change positioning, monitor physical activity. Accommodations you can do very easily, like if your child's having some difficulty writing because of a bleed at that time. Voice dictation is a great option. It is harder though, if your child has an IEP, to receive specially designed instruction. And then just in terms of trying to do virtual learning during a pandemic, you want to have a routine, you want to have some rules around when they can learn, how they can learn, when they can work, and you want to have rewards for a job well done, because this is a very hard thing to do. The other thing I want to say is that in general, and this goes for homework too, I'm very big on sleep. I see a lot of kids who have sleep problems. And one thing that I will say is you do not want your child to do homework in their bed, because your bed needs to be a place, your bed needs to be a place where your brain turns off. So you get classically conditioned to fall asleep in your bed and fall asleep easily. Kids have a hard enough time going to sleep already. If you lose that classical conditioning, it becomes very hard to fall asleep, and you get a lot of kids with insomnia. Lack of sleep then can lead to a lot of mood problems, a lot of learning problems. And so the best advice I can give general parenting wise is don't let your kid do any work or use their phones in their bed if you can. And then if you do get quarantined, just keep up the communication, be kind to yourself, schedule short chunks of time to be working, et cetera, et cetera. The challenge of virtual learning is that learning is inherently a social activity. Kids can get work done at home, but I think it is harder to learn in the same kind of way. It's harder to remember it. You might be able to pass the test, but it is harder to really lay down that understanding that you want to have. The other thing is that fear brain is activated for many, many people right now. A lot of people are feeling a lot of anxiety. And this is just, I want to show you this. This is a great picture. This kind of happens in PTSD, but even if you don't have PTSD, this same system is active. So this right here in your brain is the amygdala, and that's the fight or flight center. When you are having anxiety, it's coming from there. When you're having fear, it's coming from there. Its goal is to put your body on alert so that you can run away from whatever it is or fight whatever it is that is threatening you at that moment. But look how the amygdala is right next to the prefrontal cortex, which is responsible for attention, planning, and organizing. And it's also right next to the hippocampus, which is responsible for laying down memories, so learning. So basically what happens is that when you have a fight or flight response, you're not very good at thinking ahead or planning, and you're not very good at learning because the amygdala shuts down those systems. It's right next to them and it shuts them down. It's a survival brain versus a learning brain. You can have one active survival brain or you can be learning. So if you can understand right now why so many kids had a hard time learning last year, because their survival brain was activated and their learning brain was not. So how do you know when this is happening to your kid? If it's too much for them to do, the way that you know is if they're not responsive to rewards. So if you say to them, hey, I know this is in my house right now. I know you guys really want to watch the Jungle Cruise on Disney Plus, the new movie that's out. And if you guys get all of this work done, we will rent it for you. And they don't get their work done. That means probably that they can't get their work done. So you're offering up some sort of reward and they can't get it done. It's likely because they can't. The other thing I want to talk about, just because we're talking about learning and we're talking about the survival brain, is that there's a lot of traumatic stress happening right now. And there is more traumatic stress, of course, in the bleeding disorder community. We call it medical traumatic stress. So one thing to think about is if you've had an exposure to an event that could be traumatic for you, it's normal to have some symptoms of acute stress for about 30 days. But after 30 days, we start calling it post-traumatic stress. So the symptoms that you would see would be things like re-experiencing, like having flashbacks or nightmares, wanting to avoid the thing that was traumatic for you. So oftentimes as kids who are like, I do not want to go to the doctor's appointment, you can't make me go to the doctor's appointment. And also hyperarousal, being startled easily, jumpy, difficulty focusing attention, and difficulty calming down. So the hyperarousal, so those are the symptoms of traumatic stress. And it's important to understand that those can be ongoing. Kids can also have something called adjustment disorders, which just means that they have some behaviors of anxiety or aggression or behavior problems for a period of 30 days or so after a difficult event. So when you have a traumatic event, 2/3 of people are going to have some symptoms for about 3 months, and that's pretty normal. But about 10% continue to have symptoms of traumatic stress after a year. And for those people, they need treatment in order to get better. And you can reach out to your school or your pediatrician for referrals to some good therapists who can help. Okay, the last thing I want to talk about is screen time in this age of the pandemic. I think this is really funny. This was right at the beginning of the pandemic, saying, well, I know one piece of medical advice I won't be following, and it's the American Academy of Pediatrics guidelines on screen time, which, as you remember, were less than 2 hours a day for all kids. Well, the pandemic changed a lot of things. One thing to think about is, especially because kids are working on computers right now all the time, they have to use their phones. The screens are allowing them to be connected to their peers, and just education has become virtual in a lot of ways. Even if you're in person, you're still doing it on the computer. That's what's happening a lot of the time, is they're still bringing their computers to every class, and sometimes even socially distancing in the class and working on the computer. So you want to think about, how can you get the kids some time that they don't have their screens on? So the recommendation, this I think is reasonable. Teens and tweens should be spending 4 hours a day off screens. You shouldn't have screens at meals. You shouldn't have screens in the bedrooms or in the bathrooms, probably for the best. When they're preschool, school age, of course, you want to monitor the content. You always want to monitor the content. The guidelines have been relaxed, but make sure kids still get exercise and that the screens don't interfere with relationships or sleep. I think that's the best way to think about it. Make time for family activities and connectedness. And another thing is, it's good, no matter how old your kid is, to start the day strong with some good connection, not on screens, and to end the day strong with some good family time connections, not being on screens. And that goes for all members of the family. Okay, so now it's time for questions. If anybody has any questions about 504 plans, about emotional impacts of illness.
Dr. Bloom, we did have a couple questions. So
can I just say something really quick?
Yeah.
First of all, tremendous. Just, I could listen to you all day. And again, if you want to move to Southern California. I just wanted to say one thing, because a lot of people have been asking for either the PowerPoint. I'm so sorry. It was quite rude of us not to have asked you previously if we could record you. We did. And can we put it up on our YouTube channel?
Yeah, absolutely. No problem.
Okay, that's okay. We only have 46 followers.
And
follow us on YouTube.
I emailed you the PDF of this talk, so you should be able to email it out to everybody.
Okay, great. I just wanted to ask that. And I did also want to say that we have this Hemophilia Foundation recommended list of modifications and accommodations. I wanted to see if I could mail it to you. Maybe you could take a look at it and see if it's kind of organically grown. Anytime anyone has a suggestion to add to the plan, we do it and we say, this is not going to be all for you, but we're going to email it to everyone. Michelle, can you just pull it up really quick? I think those of you who have attended the event before have seen this, but we're going to email it to you. And if you guys can look over it, and if you see something that might be missing, just let us know. It's just this list that you could even bring to the meeting. Things like extended time for homework makeup. When my child goes to the health office, another child goes with them. Keeping my medicine at the healthcare office. So at the nurse's office. So just things like that. So I just wanted to jump in and say that.
Absolutely. Yeah.
So please help us create this list by adding to it. I think the big one was, my child is allowed to use self-defense if he or she is physically attacked, but I guess no one has yet to be able to include that in their 504 plan. But I just wanted to chime in. Okay, back to you, Casey.
Oops, sorry, I muted myself. All right, we do have a handful of questions, so I think we'll try to get to them all. So first question was, how do I upgrade to a 504 from an IEP? Especially how do I pitch that when I was previously denied?
So this is what happened to me. And the way that I pitched it was, first of all, I had the diagnosis letter from the doctor. And then I wrote an email that specifically mentioned these keywords, okay? Say that my child has a disability as defined by the American with Disabilities Act. And then I included my child requires a 504 plan because they will not have equal access to the curriculum without one. So if you have been denied that, I would try writing the email. When I wrote an email, so first I was told I was just gonna get a health plan for my daughter. And then I wrote an email and I laid out the logic and argument. So the two pieces are my child qualifies as having a disability and my child needs accommodations to get equal access to the curriculum. That worked for me to write out that letter and to have the diagnosis letter and the materials from our this is Celiac Disease Foundation, but for you guys, HFA. If that does not work, then, and by the way, this language is in the PowerPoint. So specific language that you can use to write that email is in the PowerPoint. If it does not work, I would recommend hiring an educational advocate to get it for you. They're usually not that expensive. It's usually you can pay a few $100s, even though I know that can be a lot, but it's not like a lawyer where you're getting charged $300 an hour or something. Typically they will help with this. Or Michelle, Casey, is there anything available through your organization? Any advocacy support? Like you could try writing a letter, having someone else write a letter saying it needs to be done.
Hey, Eli wants you to leave the lawyers alone. He's our board member and he is a special ed lawyer. So, you know, we can ask him, we can ask Brian. We have a sample 504 letter as well, 504 request letter. And yeah, we have a lot of resources. Just give us a call.
And you'll get some help. But
Give me a
usually
call.
the email will do it only but if you don't need it, I think you've got support in your community to help.
I think also just that point of, I think Eli will agree, is to make sure to keep everything in writing.
Oh, yeah.
Because then there's no record of what really happened.
Yeah, I would definitely recommend an email. It is that way you have the paper record and that was when I made phone calls, I didn't get the 504. When I sent an email and I laid out this argument, I did.
So
Everything always in writing. Yes, everything.
our next question, I'll keep kind of similar. Is it best to wait until school starts to request this meeting, or should we start now, send an email now and get that set up?
I mean, your child is going to have a bleeding disorder on day one of school. I mean, my feeling is that you should go ahead and get this set up beforehand. So if you can, it's not always possible, but I will say that because I was denied it, so I said, my child's not coming until this is in place. That's how strongly I felt about it. I think you have to decide how strongly you feel about it. But I do think that made everybody work a little bit harder in order to get it done quickly, saying it is not, I mean, if you use the words, it is not safe for my child to come without this plan in place, then I think it's better to get it done before school starts if you can. If they want to do it in the first few days, I think that's okay. What I have also done, because the 504 hasn't always lined up with the start of the school year. And so right this year, I do seem to have that lined up. So I'm having our 504 meeting on Monday, school starts on Tuesday, but you know, cutting it close, but we're making it work. But you know, you can also make sure that you're in contact with the child's teachers and letting them know. I would not let my child go into school on the first day of school without there being some knowledge among at least the teachers and the nurse, even if that 504 plan wasn't completely finalized and signed. But I'd like to see it done beforehand.
Thank you. And then what do we do if the school says no to setting a plan up?
So I would try again with the help of the community that you have here, with using that argument that I wrote out. And if you need to, you hire a lawyer or an advocate. I hope you don't need to. Hopefully you will get what you need in terms of community support from here, in terms of there's use of magic words. So one of the magic words is access to the curriculum. And the other one is my child has a disability.
And then do I need to do a 504 plan every year?
So it will be renewed every year and reviewed every year. So it can be renewed at any, you can review it and renew it any time if you need to, but they usually don't like to do that. They usually, legally, they have to review it once a year.
And should my child bring a 504 to college?
So it's different laws once you get out of the public school setting. So once you get out of public school, it's not a 504 plan anymore, but your child is still protected under the American with Disabilities Act. And in that particular case, yes, I do recommend that there is some sort of plan worked out with the college. It will work a little bit differently though. Same thing for an IEP. An IEP doesn't come to college either. So, and you're now under the American with Disabilities Act once you get to college. So what you want to do is you want to reach out to the Office of Disability Services at the college and then make the plan with them. But it's not as uniform. Like we have 504s and IEP. It is true in Florida. It is true in California. It is true in Alaska. Everybody's got 504 and IEP. The details might be a little bit different state to state, district to district, but those are national laws. When you get to the college level, the national law that protects you is the American with Disabilities Act.
Now for in a plan, what if the school says a child can't go on the field trip without the parent being there, or they can't ride the school bus unless the parent is there to ride with them?
The school bus on a daily basis, or
I think for a field trip.
For a field trip? So I mean that I think that you should have an alternate person who's available, assuming that you work and you can't go on this field trip. Then I would request that the nurse be able to attend.
And we had another question. Is COVID testing something to include in the IEP if you'd like medical exemption from getting tested?
I wouldn't really know what the best answer to that is. I would probably, that's a new one for me. So I would probably defer that to your medical doctors or that you're going to talk to later.
Okay, that is actually all of the questions that I had, unless someone like to put another question in the chat. Those were the questions that I had throughout the presentation. Thank you so much for answering all of those.
No problem. I mean, I have to tell you, for those of you who don't have the 504, it has worked very well for my child. It has kept her safe and healthy. We've made sure that everybody's been on the same page. And, there's always going to be twists and turns and problems and certain people who are new to the classroom and maybe don't know how to follow it. But in general, it gives you that legal protection, and at least you know that it's been communicated to everybody.
Thank you so much, Dr. Bloom. There's so much fabulous information and so many facets of our life that dovetail into the school, mental health. Stress for parents too is something that we really just can't understate, and understand that it is very stressful for us. Going into your 504 plan meeting, that graphic was perfect for anyone who hasn't done it yet. I do have to say that being able to meet with your teacher before school starts is such a golden opportunity where you can share with them how special your child is and form that relationship early. I know other people do this as well, but when I went in, I was brought Starbucks and like donuts or some kind of little brown nosy thing, and told the teacher, I will support you, whatever you need. Please take care of my child.
Yeah.
Not in so many words, but sort of not coming out with like my guns out and being like, I'm going to sue you. But to really just say, this is a partnership and let's be successful together.
Yeah, I think that that's really important, Michelle, really, really key. I mean, people do not go into working for a public school if they do not want to be helpful to the children who are there. Teachers generally, they love their kids. This is more than a job for them. And, you do want to have that attitude with them. I do the exact same thing. So there have been times that for some reason our 504 was renewed in like March. And I'm like, well, this is not helpful. Maybe we can figure out things for next year, but I really want to talk to the teachers before my child goes in so we can prevent problems. So what I have done every year is that I have emailed them and said, here's a little bit of information about my child's medical condition. I would really like the opportunity to come in and meet with you face to face so we can prevent a lot of problems and develop a collaborative relationship to make sure that things are positive. And I go in there with a basket of supplies that they're going to need for the classroom, a bunch of gluten-free treats, some printouts, on some infographics that will give them some information. And yes, a Target gift card, because please take care of my kid. And every time I have left with a teacher's cell phone number. I get texts throughout the day. Hey, this is happening. Is this okay? And that has just prevented so many problems. And it's because, I try really hard to develop a positive relationship.
There are a few teachers on the call, so I think and don't forget your district school nurse. They also like gifts
Absolutely.
and treats. And then just one other point, I also wanted to add that to think about maybe bringing your child to the 504 plan meeting and having them talk about their experience. And it's sort of like a great advocacy practice for them to explain what their bleeding disorder is, whether it's VWD or hemophilia, show that simple graphic and explain it. And if you really want to wow the teacher, bring that clotting factor or medicine, whether it's sub-Q or IV, and be like, I tell you, bring out the IV treatment, the infusion supplies, especially to legislators. They like faint on the floor when they learn that the kids do it themselves and things like that. So I think it's great to bring the child.
Yeah, I think once you get to a certain age, I think it's really great. And even if at the beginning they're listening to you do it, then over time, like maybe in middle school, you bring them along and they
Right.
listen to you have
Yeah.
this meeting. And then over time, they hopefully will lead the meeting, because the
Right.
whole goal, and something I think you guys are at a community are fantastic about, is getting these kids independent. And that really helps a great deal.
Right. And then maybe to also let the teacher know, hey, my kid's going to show up with a ton of bruises. They're required reporters, right?
Yes.
So that.
Yes. So yes, teachers, if anyone doesn't know what that means, teachers are mandated child abuse reporters. And one of the things that they're often looking for is a lot of bruises. And I'm sure it's happened in the bleeding disorder community where a call has gone in. And so, if your child took a fall and has a lot of bruises, or if they're just generally bruising a lot, it's good for the teachers to know that, maybe avoid that call so they don't have reason to be suspicious in that particular situation.
Right. And then we have 2 more minutes. So we have one last question. In high school, can you request that all the teachers be part of the IEP meeting? My school has shared that only core teachers, non-elective teachers be present.
So that's unfortunate, because I think for you guys, the main thing you need to worry about is PE, right? So, I mean, in this particular situation, I would just explain to the staffing specialist that, that it's really important that the PE teacher be there. So for this, you can't force any particular person to be at the meeting, though. It's really up to the school. Just like you get to bring who you want to bring, they get to bring who they want to bring. But I would think that logic would prevail, and you would say, can we schedule this please at a time that the PE teacher could come? You might not get the music teacher there, and in that case, the teacher should get a copy of the 504 plan and all the accommodations. You can certainly email that teacher, but you can understand it can be hard to get 7 teachers in the same room at the same time.
Yeah.
Unless you do it before school starts. The week of pre-planning, I think, is a great week to have that meeting.
Yeah. Okay. Well, thank you again, Dr. Bloom. We really
pleasure.
appreciate it. I think this was one of the best presentations I've heard. So thank you so much. Maybe next year you can join us in person.
Well, that would be fun.
Yay.
That would be super fun. We would love that. I would love that. Thank you guys so much. It would be great. I would hope we can all be at that point where we can all be in
Yes.
person at this time next year. I really hope so.
Yes. Thank you.
Thanks. Take care, guys.
Okay, bye.
Bye-bye.
Thank you, Michelle.
You're welcome. I don't know who said that. Stop spotlighting me, Casey. Oh my gosh. I really can't wait to get off the screen. All right. Phew. Take your bathroom break really quick. No, I'm just kidding. Take it whenever you want. We are going to go to a lot of questions and great discussion. We have a panel of we call them expert stakeholders, because this is really where you can get the inside scoop and ask more pointed questions. Feel free to ask your personal stuff. I'm going to introduce them. I think many of you already know. We have Brian Iavicoli. He is a board member and he's a school nurse, not the health aide, but the actual school nurse for the Bonita Unified School District. His daughter was born with a rare congenital bleeding disorder called Glanzmann's thrombocythemia. By the way, I do believe that there are 120, Brian, nationwide diagnosed. Not too many. So this diagnosis brought the family into the rare disease community, and ultimately, thankful for us, the Hemophilia Foundation of Southern California. Brian has worked in the healthcare industry for over 18 years. He began his work as a psychiatric tech, caring for the developmentally disabled at Lanterman. I did not know that, Brian. Wow. He previously worked as a registered nurse, also in the acute care setting, with time spent in both the medical surgical wing and ER. And then Brian transitioned to school nursing 2 years ago to help promote and educate and assist individuals like his daughter so they may succeed in the school setting. He has incredible experience. And we thank you, Brian, for joining us today. We also have Eli Economou, who is also a recent addition to our board. He's been practicing educational law in Southern California for 11 years. And during that time, Eli has worked tirelessly advocating for students in Orange County, LA, Riverside, San Bernardino, and Antelope Valley in gaining appropriate scholastic services through IEPs. He has extensive experience with several districts in Southern California, and in all matters, Eli strives to maintain a professional but effective and zealous representation of all his clients, and has consistently attained appropriate services for those students whom he has been lucky enough to represent. And he also has extensive experience with providing estate planning, including wills, trusts, powers of attorney, conservatorships. Something I don't know if we have time to touch upon is, what we discussed. 18-year-old, highly recommend you might want to look into getting a healthcare proxy, because both the school and doctors will no longer include you in the conversation as a parent. And then we also have, many of you know, Dr. Donahue, Dr. Jackie Donahue. She's a licensed psychologist with postdoc training in pediatric psychology. She completed an APA accredited internship at Dell Children's Medical Center, where she provided therapy, consultations, neuropsychological assessments for children, adolescents, and families who are experiencing chronic and life-threatening conditions. At CHLA, she provides ongoing therapy services to patients within the Cancer and Blood Disease Institute, and provides in-clinic consultations and brief interventions in the Hemostasis and Thrombosis Center, the HTC at CHLA. Let's just put it that way. And then finally, thank you, Dr. Kwan. She's our medical advisor, and she's joining us today. And please interrupt me while I'm on the Zoom call, Joshua. And many of you know her. Joshua, get off. Sorry, my child with a bleeding disorder. Do you want to get on the panel too? Thank you, Dr. Kwan, for joining us and talking to us about transition to independence and adulthood, like that. All right, who wants to go first? Let's pick on Brian.
Let's do it. Although I feel like I'm going to say the same things that have been said because Dr. Boone did such a wonderful job. So, but let's just do it. You know, we'll reemphasize everything, I guess. Am I just talking, Michelle? You're muted.
Thanks,
So
Brian. Yeah. So what I did is what I asked from their particular, you know, they all come from different perspectives, but they all have pretty much involvement or could have involvement in your child's school plan. So I asked from their perspective, what are the three things, what are the obstacles they see that they've experienced, that they've seen? What are some pieces of advice that they would give to parents? I asked you a whole bunch of questions, Brian.
got it. Okay,
Sorry.
I can go from there. No, I can go from there.
Yeah,
So I
from
think,
the district school nurse perspective.
yeah, I think for me, in terms of what I would see from my perspective is never to wait. And I'm speaking from public school, but things move really slow in public school, which is like the hardest thing for me to get used to coming from the ER. But and to understand that, you know, putting things in writing, not waiting, and immediate, like if you know that you're going into school, your kid's going for the first time, or you get some sort of update from your doctor, to put it in writing and get it to the school immediately. As a nurse and teachers, I can tell you the number of emails that we get per day is just, it's overwhelming, and I miss things all the time. So I would always advise you when you're doing that to just ask for a response, make sure that they saw that, and don't just let it sit there. Because, you know, if they didn't see it, you know, you start timelines with the letter stuff, but if they never got it, give them that benefit of the doubt so that you know that they did see it in the end. Other one is to make attendance. I know we've talked about it. I would make attendance a part of the discussion right away. Don't let, when we're talking about including for appointments, for, you know, for emergencies. With my own daughter, we've talked about coming in late because of infusions. And we also discuss, and another thing that I do is always with parents when we get to, especially middle school and high school, is to start putting consideration to what that first period class is. I know, you know, when you're talking about a difficult needle stick in the morning or running late, and it's that first class is one that they're probably going to be tardy to the most, is to start putting considerations in what is the class that they can maybe miss a little easier. And, you know, whether that's PE or an elective, and I know PE is like the super serious thing in the schools. It's way crazy, but I mean, it is just one of those ones that you might want to put into consideration there to consider your first class and also the last class of the day as well, because you start thinking about fatigue. And if that's an issue with your child, especially when you're dealing with bleeds and joint bleeds and other issues. I also think to enlist the help of mental health resources early. I know somebody else will probably talk about this, but even for my own daughter, we have asked that the mental health, her mental health counselor at school be included in her 504s. It's been phenomenal, the amount of help that they've given us with our daughter, and just to have that extra. Now, just so everybody knows though, is that mental health resources and school resources, they vary really widely between school districts. These are not like, it's super inconsistent. Your school district might not even have a school nurse, and I'm being super serious, like that is a reality. So, but you know, the resources that you do have, take advantage. When I get a kid with a chronic illness coming in, not necessarily asthma, but if a kid with like hemophilia comes in, I immediately connect them to our school mental health counselor. It's one of the first things I do, because I think to even have that discussion where the kid has somebody to talk to every other week or every week is super, super important, and something that a parent does not know. They're dealing with so many other things. That's the last thing they're going to think of. And it's one of the things that I think should be at the forefront of their mind. And then something else I wrote but they talked about was the PE instructor. Make sure your PE instructor is at all these meetings. They're like the most important one. I don't think that they're an elective. Like I said, PE is mandated in California, so I wouldn't consider them an elective person. So they should be at these meetings. We've had meetings stalled because our PE instructor did not make it, and our principal held the meeting for a good 20 minutes while the PE instructor came. So just something to consider. I would not think that that's somebody that shouldn't be there. They should be there. But like was discussed, if they can't, it gets very busy even at the very beginning of the year. That first week when the kids aren't there is super busy at the schools, just so everybody knows. We have time, but getting, especially with middle school and high school, 7 teachers together is near impossible. But just have a plan and know what the nurse's plan is to disseminate that information and tell the other teachers that couldn't be there, I think is really important. So that's it for those 4 things. Obstacles and challenges that I see with kids with chronic illnesses is really the kids getting older. I see a lot of issues as they become older. They become more private. They become more rebellious. They don't want to necessarily do their factor or tell people things. And so and also as they get older, you have more teachers and administration to handle. So really what you need to do is just to foster that communication really early. That's why I think when we talk about tips for success is getting your kid involved early and teaching them to communicate, because that's why, like, we've tried to have Amelie at our at her 504. She hasn't always been there, but even just to be there to watch and to understand the communication, because as they get older, you're relying on them to tell you when something's wrong. You can't always depend on the teachers to see something. And especially when they start to get classroom sizes where they have 32, 33 kids, it becomes way, way harder. Right now she's in a class with 22 kids, but that changes dramatically in a year. So, and there's, like I said earlier, there's a lot of differences in nursing care across school districts, but your child might be dependent on a front office staff being the one to give them the medical care. And so to know the plan that's in place and to really understand it, but that doesn't mean that their access to education should change between districts, but just knowing like what kind of care you're going to get. We're lucky in our district, we have a lot of nursing care, we have a lot of LVNs, but I've also been in a district before where I was the one nurse for 9 schools. I had 10,000 kids. So it's just, knowing how to, what you're working with your school is super, super important, but realizing that they need to be able to accommodate your kid with the services that they're providing. It's law, it's what has to happen. And and I already discussed on the self-care, especially at their younger age. And just, with the 504s, like I said, with Amelie, I wouldn't ask her to be involved yet, but it's really great when you start to get to middle school, if they can start to actually talk. But I wouldn't ever force her to. I don't want to put that on her, because then she's going to hate me anyways for it and everything else. But if they're able to make that personal connection with the teachers early on, I think it's really powerful, and they're able to really start advocating for themselves. And when they start doing that is when they're going to be able to discuss and say that something is wrong at school. So tips for success, I already said, get the child involved early, know your rights. You have all this information you got today. You have that booklet. Don't let them tell you that you can't get a 504. Understand the difference between a 504 and an IEP. We've had advocates come in and, yelling that a 504 is not sufficient. 504s are very powerful. They have a lot of legal backing. And so, and they do a lot of good. But don't let people push back and say that a health plan is sufficient. I don't think they are for any bleeding disorder. I would not settle for just a health plan. So, always go for that 504, know your rights with that. And Michelle, you said the same thing. I think it's really important to appeal to the administration and the teachers and get on a really good, standing with them. And like you said, butter them up if you have to. Now, if it gets to a point where you have to go, to district because they're not meeting your needs, that's fine. But having good standing with them, it's that whole thing in the ER in the hospital. It's terrible. But I mean, do patients get better care when they have family members at the bedside? I don't know. Sometimes you think that maybe, the nurse might be a little more attentive. And I think, when you have good relationships and you need things, done for your child at school, and, having, a staff that knows you, is familiar with you and appreciates you, and you've given back to the school, you've helped, when I think that's very powerful, and it's going to get your child further along as well. So that's it. That's all I got. I don't know if
That's great advice, Brian, and you're a great speaker and passionate. We appreciate you. So far, no questions, but I think that we're going to move on to Eli then to give us his perspective as an attorney. Can't hear you. Nope. Let's see. Okay, try. Oop, nope. All right, we're going to move on to Jackie. I'm just going through the order on my screen, so it's not Dr. Donahue. I'm so sorry.
Thank you, Michelle. I do have a PowerPoint that I'd like to share with the families. And I think Casey might be able to put that up for me. Okay, looks good. Can you just go back, pop over back to the first slide really fast? Okay, so hi everyone. I hope you're having a good day. I'm gonna just present on how to implement some mental health tips for a great school year. I know everyone has been through so much, and so this presentation is really to just provide some education about mental health. I really wrote it so that I don't want to startle any parents. I don't want to worry any parents because I will be using some words like depression, anxiety, mental health. And so this is not meant to diagnose anyone. This is just so I can provide you with the support and education about mental health and how it specifically relates to school. So you can go ahead to the next one. And are you guys hearing me okay? Because I was told that I had a glitch on my connection on my side, so it's good. Okay.
We can hear you fine.
Yes, we can hear you.
Great, great. So I'm going to talk a little bit about how mental health and physical health are related to each other and how they intersect. So first and foremost, I want to say that kids and teenagers with hemophilia and other bleeding disorders are, as a whole population, do really well. Majority of them do not experience significant depression, anxiety, behavioral problems. And I think that's really because of the social support and the medical advances and the quality of life that the kids have nowadays. But I just want to touch on some things to be aware of. So kids with chronic illnesses such as hemophilia or bleeding disorders are at higher risk than kids without chronic illness for experiencing some things because living with a chronic illness is really challenging. So they may be at risk for problems with satisfaction at school, peer relations, social support, self-esteem, anxiety, depression, and behavioral challenges. So these are just kind of things that when I meet with families, I'm kind of keeping an eye out for, seeing how I can support them and the family. And we do know that there are some things that may increase the risk, and I want to highlight may because it's not for sure that it will. But just so you know, the severity of hemophilia, having bleeds, joint pain, joint impairment, limitation of activities, and then I had to put COVID in there. These things may all increase risk of experiencing some mental health difficulties. Next slide. Okay, and so I put this together as kind of a nice picture or visual of things that can impact school functioning. And so this can be just challenges at school, maybe learning challenges. So bullying is something that happens at school, and that's not just in-person school. That can happen virtually, that can happen via social media. So that's something that we always want to keep an eye on. Physical activity and sports. So limited in physical activities and sports can difficulties at school, especially if your kids don't know. Oh, it says connection unstable. Can you guys hear me?
We can hear you.
Yes, okay. It keeps telling me that my connection's unstable, so just had to check. Relating to peers, feeling different than peers can cause difficulties at school, learning and academic challenges, like we heard about earlier. And that can be caused by either, absences, falling behind, or other issues that may require an IEP, and then mental health, which I put here at the bottom and kind of highlighted, and I'm going to talk about it more in the next slide. Okay, so I kind of separated school-related mental health signs and general mental health signs because we are going into the school year, just to kind of highlight that section. And I also wanted to say that mental health in children and adolescents, the signs can look a little bit different than adults. So I wanted to point out some of those differences here. In terms of school, we want to look at if things are changing or becoming worse. That can be a sign that that the kid's mental health may need some extra support. So things like decreasing grades, less social interest, less motivation for schoolwork. And these three things kind of look like something that happened during COVID for a lot of people. So you know, it's really something to have a conversation about, like what is really driving this. But these are just some warning signs that I wanted to make families familiar with. Also, physical symptoms. This can happen a lot in younger children where they start to show their anxiety or their sadness in physical ways. So things like headaches, stomach aches, feeling nauseous, and these things can happen for other medical organic reasons, but they can also happen because of anxiety or sadness too. Wanting to be near you more or avoiding school. That's another school-related symptom or warning sign. And then in general, there's many other things too that can trigger you to think if this is mental health related. So isolating more, wanting to be in their room more, sleep and appetite changes are a really big one as well. Low mood, tearfulness, irritability can be a pretty big one in teenagers. And I don't want us to write it off as, you know, being a teenager and going through that developmental stage. It can really be a sign of a bigger mental health problem too. Tantrums and behavioral difficulties, less engagement with medical care is a big one that comes up. So teenagers or, you know, adolescents not wanting to do their factor, not wanting to help out with their medication. It can be a sign of just having some negative emotions about their medical illness. And something to look further into, kind of question more. Less interest in activities. So, you know, your child really loved painting or going outside and they don't like that anymore. That is something to look at as well. And then stress, worry, or panic symptoms. Thank you. So I wanted to put this together as kind of a brief, I could do probably a whole presentation on this topic, but this is just a snapshot of some things that you can do, not only to address when you're seeing mental health problems, but also to promote positive mental health. This is to, you know, when your child is doing really well, we want to keep that going also. So I included some tips for that too. I'm really big on promoting expressing your feelings. That's like number one. So having an environment where your child feels safe and comfortable opening up and expressing their feelings is really positive. Activity. And it's more of an open-ended question. It helps you get more than just a response of fine or my day was good, and it promotes talking more. So you can ask your child, tell me something that was a high for you today and something that was a low, something that could have been better. Some parents like to say peak or valley. So something that was a peak and something that was a valley, just to, you know, get them to talk a little bit more. Pointing out your child's strengths is really important. It helps them learn what they're good at, helps them focus on positive things as well. And it's okay when things are not always positive either. It's a very challenging time, like we've all mentioned, and it's okay to acknowledge that, you know, this isn't how we expected things to be, and that's okay. And parents can share their feelings too, in an age appropriate way with their kids, but it helps the kids to learn that sharing feelings is okay when the parents are comfortable with it as well. Role playing to practice talking about hemophilia is something that I do with patients as well. And this is really unique to every family. If you feel like your family is not comfortable talking about hemophilia with other people at school, then that's fine. That's totally a family choice. But I do find that it's helpful to, ahead of time, practice with your kids how they're going to share with their peers about their hemophilia, or how they're going to talk about why they were absent at school, or why they're now on crutches. It just helps them feel more comfortable and not put on the spot when they're asked that inevitably at school, because kids are curious and it's going to happen. So I like recommending that to families as well. Encouraging routine with a variety of activities and flexibility. This is just in general for every kid and family during COVID, but especially kids with chronic illness. Some kids need more breaks. Some kids need more structure. It really just depends on the family. So if you feel like, you know, one of your children needs something that's different than the other, that's okay. And that's actually better for their mental health if you can help to accommodate that. Sleep and nutrition are foundational. This, I think, was talked about before, so I won't spend too much time on it, but this is like, if you can get a sleep routine down, you're setting yourself up for a really good day, better chances at a good mood, and also nutrition is really important too. Physical activity within medical limits is something that I recommend. Variety of activities, not just on the tablet, but maybe also going outside, but also considering the medical limits of a bleeding disorder. Seeking school accommodations, we talked about that. Seeking additional support from the school or mental health professional. This one is really important, especially if you start seeing some of those things like changes in mood, changes in grades. You can always ask the school if they have a mental health therapist there that can support your child in the school and provide therapy. If not, you can reach out to your pediatrician, hematologist. If you're a patient of CHLA, you can always ask to see me or a social worker. I like meeting as many of the families as I can, whether there's a mental health concern or not. I just like knowing the families in general, because I will see your child grow up, and I just like to know you in that respect. If you are not able to get in contact with a medical professional who can help you find someone, I would recommend looking on the back of your insurance card and contacting them to find a therapist that way. And then, of course, this great community, using social support is so big. It's one of the biggest things that we know can help mental health. So please, please use your resources and the hemophilia and bleeding community. It's such a great resource. And that's all I have.
Thank you so much, Dr. Donahue. That was true that we could spend probably hours on this topic. We appreciate all that great information. Mental health services, someone put in the chat, to the IEP. I'm not sure you can add that to the 504. Okay. Eli, are you ready to go? Let me unmute
I'm
you.
going to try it this way.
Oh, there
Can
you
you hear me?
go. Yeah, you're even muted and you're speaking. Wow, you're magic.
I'm doubling up here.
All righty, thank you.
All right. So it's been a ton of good information shared by everybody that I could definitely reiterate. I'm going to say a couple of things that Brian hit on because they are extremely important and I think they're worth mentioning twice. Number one, anytime you put any kind of request to the school district, always in writing, dated, signed, and then keep a copy for yourself. I can't tell you how many times parents say, oh, well, we had this conversation, on this date and this date and this date. And then it just kind of falls by the wayside. And they don't have anything to look back on to say, oh, it was on this date and I have this writing that shows it. So just always put it in writing for your reference, for your own peace of mind, literally anything, any request that you're making. Number two, when we're talking about 504 plans, a common misconception is that you do have to have annual meetings. That's not true. It's periodic re-review, and that means something different to everybody. So if you feel that an annual meeting is appropriate, you as a parent need to be that zealous advocate for your child. And I hit this a lot on presentations that I do with parents, and I say zealous advocate, but if you don't do it, nobody else is going to do it for you. So, if you feel like an annual meeting is appropriate, say, hey, we had a meeting last year in March. I need another meeting this year in March. And so let's set it up. Also, when you're talking about a move, let's say you had an individual health plan and you're saying, okay, now we need to transition to this 504 plan because I need a more extensive plan in place for my child. That's great. The law states that there has to be an evaluation of your child before they create this plan, the same as an IEP. And this is a step that is skipped a lot of times when creation of these plans goes into place. And the purpose of an assessment is to address specific areas of need. Maybe there's some things that you didn't think about, or some things that a teacher is seeing, or a medical professional seeing that you're not seeing. And that's what these assessments are for, to drive the nature of these plans. And that has to take place before creation of a 504 or creation of an IEP. Now, there's a little bit of contention as to the nature of an assessment prior to a 504 versus an IEP. When I'm addressing things, I want that evaluation to be a comprehensive psychoeducational evaluation, no matter what. But for purposes of a 504, it just says evaluation. But just make sure that that process is taking place so that the plan that you get is informed versus just, hey, let's sit down and let's think of, a dozen things that little Jimmy might benefit from. Also, to reiterate something that Michelle said, I don't think that necessarily we're talking about buttering up the professionals that work with our kids. They're human beings. And, so what we're talking about is working in conjunction with people towards the benefit of our children. But, bringing in donuts or, coffee or, dropping off a gift card, that's human nature. You're going to look at that and you're going to be like, you know what, I like this person. I'm going to try a little bit harder than maybe I would otherwise to try to benefit them or work with them. That's just the nature of things. I do that with my kids' teachers because my kids are behavioral nightmares. So, to front load the headache that every teacher is about to go through, I'm going to come to those teacher meetings with something in hand and be like, I'm sorry in advance. But, I think that is a way to make you stand out and make your child stand out the way that they should. And I don't think that's necessarily problematic. Let me see what else. So obstacles. I think when we're talking about health issues, school districts sometimes look at those as being outside the realm of educational. So making that connection, and I think Dr. Bloom hit on this as well, making that connection to the educational aspect of how your child's health condition detrimentally affects their education is imperative. So you say, okay, my child has a bleeding disorder and therefore they need a 504 plan. That's not going to do it. You know, we need to say my child has a bleeding disorder and therefore this is how they're affected at school and in learning. And that is why they need a 504. That is why they need an IEP. That little extra step in your brain as a parent, you're like, this is obvious, right? Obviously they need this plan. Obviously it's affecting them educationally, but the school district's responsibility is to address educational issues. So you have to make that connection. And I say educational because education has two aspects of it. It has academics, but it also has the social emotional aspect. And I think Dr. Donahue was talking about, Dr. Bloom was talking about it, Brian talked about it. Social emotional functioning is just as important as academic functioning. And if they're detrimentally affected social emotionally, that can entitle them to those benefits as well. We can't take out, you know, you can't say my child is having mental health needs and they're going to say, well, they're getting A's. So, you know, we don't have anything to do with that. You know, they're getting A's until they're not getting A's. You know what I'm saying? And so the law states educational benefit. It does not state academic benefit. So, and that's the reason why, to include that social emotional aspect. So if your child is struggling with social emotional needs, that can qualify them for 504 or IEP, the same as just struggling with academic needs. I have plenty of clients that come through my door that are twice exceptional. And, you know, they're looking at being able to overcome a lot of things with their cognitive ability, but they're struggling behaviorally, they're struggling social emotionally, and that's why they're qualified. So what else? Tips for
Eli,
success.
can I just add one thing? Can I add one thing to what you were saying? Kind of jog my memory. You can ask for your psychologist or your child's therapist through school to be a part of the IEP or the 504 plan meeting. Like Dr. Bloom was saying, we don't want our patients to just survive. We want them to thrive. We want the teachers to know how to talk with the kids in a positive way, how to help them learn about their body and not just punish them. So that's the piece where psychologists, mental health workers, therapists can be a real asset to the IEP or 504 meeting too. So you can always ask for that as the parent.
So I'm gonna kind of rehash something that Brian said, but as a parent, we need to be able to stay on top of what's going on at school and follow up with what's going on at school. Teachers, nurses, administrators, like Brian said, they're getting tons of communication. They're dealing with tons of parents, tons of kids. And it's not, I mean, if something falls through the cracks, it's not intentional. Educators become educators because they love kids and they want to help kids. The burden that's set on them by the federal law is high. And sometimes it's just unattainable without a parent being there to say, hey, you know, we made this communication and it's been a couple weeks and I haven't heard anything. And I want to make sure that this happens. Or, you know, this program or plan that's in place is not effective for my child. And I want to sit down with you guys and I want to make sure that we hash this out. Again, being a zealous advocate for your child doesn't mean you need to be a problem. It doesn't mean you need to roll into a 504 meeting and an IEP meeting and blow it up and start screaming at everybody and threatening lawsuits. You know, it just means staying on top of things and trying your best to work with the school professionals towards a beneficial resolution. When the federal law that was created for special education came into being, the Individuals with Disabilities in Education Act, the federal lawmakers anticipated a situation where parents and educators came together for the benefit of the child. And that's the way it should be. And so, you know, for you to say, okay, I communicated with them 2 weeks ago and I haven't heard anything, so I'm going to reach out again and make sure that this is falling into place. It's not problematic at all. can't tell you how many clients I have that come through my door and say, yeah, I requested an IEP. I said, okay, well, when did you do that? Well, February, and it's now September. And I'm like, well, how many times have you reached out again? Well, I haven't reached out again. And so, you just basically waited all these months when most likely if you had reached out again, it might have happened. And, again, I'm not going to say that sometimes it wouldn't have happened anyway, but simply for the lack of communication. And if this is important to you, which of course it is, these are your children, it's worth keeping going with it, making sure that it is a collaboration and that you're not, just serving this over to the school district and being like, ball's in your court now, let's go. Making sure that collaboration's in place and making sure that you're staying on top of your end. To that end, again, I'm going to say it again. I can't say it enough. Make sure that everything's in writing. Make sure that any requests you make are in writing. Any communications you have are in writing. Keep those writings. Keep your school district records in a binder. However you like to organize it. Some people like to organize it by type. I like to organize by chronology, but keep your records. You want to be able to sit down in every meeting you have with your school binder and say, back in 2019, this was what the plan looked like and it wasn't effective, but now you guys are saying that you want to implement these same accommodations and I don't think that's appropriate. So let's try to think of something else, versus sitting in a meeting and going, oh, I think back in 2019 this happened. So, having those records present, maybe you don't need them, but maybe you do. And just having them there is beneficial for everybody. It's beneficial for the school district too. So keep your records, keep them in a binder, make sure that they're easily accessible for you to be able to review under any circumstances. Also, this might be self-serving, but if you have questions, ask people, find an advocate, find an attorney. If you feel like the school district personnel or somebody at the school district has been beneficial to you in the past, ask them. Don't feel like you're alone. Don't feel like you have to go through this alone. There are people out there that have a lot of experience that are willing to help you, that are willing to give you advice. Contact Michelle and she'll know how to contact me. I'm willing to talk to anybody, give anybody some advice or direction if they need it. But don't think that you have to do this by yourself, because you don't. There's, this is a great resource for you. I can't tell you, just hearing Dr. Bloom and going through the book that we're about to let out here. This is an amazing resource for you, much more so than a lot of things I've seen in the past. So, make sure that you reach out to people that you trust or people that you know to help you.
I have a
I
quick
think that's
question.
good for me.
Yeah, no, that's fabulous information. What happens if the school doesn't follow the 504 plan? I'm imagining if it's a small infraction, maybe you talk about it, like they accidentally excluded your child from soccer, where the 504 says they can play soccer, just not goalie, or something like that, versus something a lot more significant. Is there any action, or would you just recommend like having a sit down meeting?
So first, again, you have a 504 meeting. The 504 plan is created. It's disseminated. After that point, it's going to be up to the individual professionals to review that plan in every situation that it might occur. And that's, again, a very high bar. And so what might have happened is whoever it was that failed to follow the plan just hadn't had the plan disseminated to them, or they had the plan disseminated to them, but that day things got hectic and they're like, oh, I totally forgot. So I think your first step is always to try to work with the professionals that are working with you. A lot of my colleagues in the student side legal field would disagree with me, but I am always an advocate of working with school districts, parents and school districts working together first. And so sitting down either with that person individually, if you have ability to contact them, or saying, look, we need to hold a 504 meeting because my 504 plan is not being followed. And we want to make sure that everybody involved has the plan and is following it strictly, because that's how my child is going to benefit. Now, if you make that request and that request is not honored, or if you make that request and you go in and they're like, well, you know what, actually this accommodation, we don't think we're going to follow it, and we don't think it's appropriate, and you do, then you can initiate a 504 complaint procedure. And it's super simple. You find out who the 504 coordinator is at your school district, and you send them a letter saying, I'm filing a 504 complaint because you're not following my 504 plan. And then they have to do an independent investigation and provide you with remedies. I don't personally think that any parent needs an advocate or attorney to do that. Again, this should be a cut and dry process. Now, if we're going up the ladder here, and again, they don't, they come back and they say, well, we did an investigation and there is no problem here, then you're going to want to contact someone to help you, because then you're going to have to go through federal law complaint procedures. But hopefully nobody ever gets there. And I very, very rarely see it get that far. Most of the time, if you ask for a sit down, it is just that simple. The school district says, look, our bad, this plan didn't get disseminated, or this individual had a bunch going on and just made a mistake. And then you can resolve that at the school district level. But there are plenty of steps to take to be able to address that.
Great. Thank you, Eli. I didn't know that. That's great information. I'm going to hold off on Delia's question because that's a really good one, but it sort of dovetails into Dr. Kwan. She's going to speak about that transition. Rebellious teens, what, Brian? And going to college and all of that. So
this has been a great session. I just wanted to say thank you to all the speakers so far. It's just been wonderful to hear all of this and to know that the kids are going to be prepared for going to college. And that being said, I think that I'm not going to say anything new, but I think it's sort of how I look at it from my point of view. And it's pretty much the same information. Sort of what's really important and what I'm seeing is that the keys are communication and preparation, right? As a parent, you're preparing your 504, your IEP plans, and you're communicating that with the district, the schools, the teachers, the principals, everybody that's involved with your kids' education. And what I think is really important for the parents also is to get your children involved at some point. And as Brian said, he has Amelie involved in some instances, she has been involved. And I think that's important because when they transition to college, it's no longer really a 504 or IEP plan, but what they ended up going to in college is the disabilities office. Dr. Bloom mentioned that at the very end of her talk. And I know that it might vary from school to school, but at least when I've dealt with a little bit, and it's UCLA here because that's one of the local colleges or universities, they take this, the Office of Disability takes it very seriously. My husband is a professor there, and he makes all sorts of accommodations for his students, whether it be for the final, for any midterm exam or anything like that. Whatever is in place, he makes the accommodation. And the professors have no idea what the disability is. That's HIPAA, and it's none of their business. They just have to make the accommodation. And so professors take it very seriously also. And so again, it comes back to communicating and preparing. And if you prepare your child, have them be a part of their 504, have them know what is supposed to be in place, they can go to the disabilities office being educated about what they need and discuss it with that office. And I think that's really important, is for the parents to have their kids involved and be a partner, that by the time they're 17, 18, you want them to be managing, or at least being able to manage their disease, to be able to explain it, to know what medications they're on. So again, another piece to the communication is, and preparation, is education. And so I think those things are really important. And also knowing their physical limitations, if there are any. So for most hemophilia patients, this is specific for hemophilia, most of them may not have physical limitations because their treatment is so good, but there may be some other things involved, where if they fell and had a bad ankle or knee, or if they had a bleed, that they should be able to communicate with their professors about what their problems are beforehand. And so again, it comes back to being prepared, that you may want to go and talk to the professors, whatever classes that they have. If at UCLA, things are just spread out all over, and to walk from one class to the other may take you 10, 15, 20 minutes. It's a long walk. And if you have a bad ankle or had a bad bleed and are late, then again, being prepared and having that communication with the professors, like, hey, this may not happen very often, but it might happen if I have a bleed. And as we all know, bleeds are completely unpredictable. As Brian mentioned earlier, if you have to prepare in the morning to take your factor, whatever, your first period might be affected, the same thing. The professors, your first class in the morning, if you know you have a hard time, please don't schedule your classes all at 8 in the morning, because you may not make it. So again, preparation is very important, and knowing what your limitations are may also be important. So all of these things, again, I'm not saying anything new that everyone has not mentioned already. It's just sort of framing a little bit differently for when you go to college. And I think what's really also very important is mental health. Patients with chronic diseases often have anxiety and depression. And I think that's really important to be able to talk about that with the students, and make sure that if they're starting to feel overwhelmed or having anxiety, because it's an added, I don't want to say burden, because I don't want to feel like their disability is a burden, but having this added issue, it can affect you mentally, and it's a chronic disease. And we all know that this is an added stress for somebody who's already going into a stressful situation, especially if you're starting at a new place and you're moving, starting a new school, having to make new friends. We all know that can be very stressful. So again, being prepared and knowing that you can have social supports, make sure that you are comfortable looking for professional support, and your family or whoever is involved in the children's lives, when they move on, make sure that they know that their support is still there. And I think reinforcing that would be very important. Setting up proper schedules, sleep schedules, nutrition, make sure they're eating well. Those all things are very important to discuss. And one thing I wanted to bring up is medication management. At some point, Michelle's smiling, make sure that your children understand, again, comes back to communication and preparation, right? Making sure that the patient person understands about their medication, when they need it, when they need to take it, and make sure they have enough. And then reaching out, if you're moving to a new area, reaching out to the closest HTC to make sure that they're connected with their new medical home, or even if they're not going to be there permanently, at least be connected to the local medical home if they're also going back to their home, so that they have somebody locally taking care of them, as well as their core team back where they're from. I think that's really important, because a lot of students actually, well, they're from the Bay Area, they come down for UCLA, and they feel like, well, I just go back once a year. Well, if something happens during the school year and they can't get back to San Francisco quickly, they're going to need somebody down here to help take care of them. I think it's important to at least touch base. You don't have to change your home base, but at least touch base with somebody locally, whether it be just the school doctor to say, hey, check in, I need this medication if I have a bleed. Is it on formulary, or can I get it easily, or do I have to bring my own in? It's just again, coming back to communication and preparation. I don't know if I have anything else to add, because everybody has really touched on a lot of things already.
Yeah, that's so important. I think that when you have young kids, you don't really think about it, but that medical management, having them start ordering their factor and supplies when they're home with you and in high school, and be in charge of it. Because my son started in college and he didn't realize he had to order supplies with his factor, and he was reusing his syringe. So hello, it's like, well, I didn't get any supplies with my factor. I'm like, well, then you can actually ask them to mail it to you.
But I think, again, it's just, if they haven't been involved, I think, they just start needing to be involved. And that's why I say, like, having them come to the meeting where the parent is meeting with the school could be very important, because those same things may need accommodation in college. And if they know what they are, it's much easier for the student to communicate their needs.
There's just one question, and I don't know who wants to take it, but it's from Delia. So if her daughter doesn't think she needs a 504, but the parent may think differently, or the parent actually sees the child struggling, what can be done in that situation?
I'll answer it if nobody else wants to. So I get this kind of fact pattern presented to me a lot of times, especially with the older kids. And what I suggest parents, that the tact for parents to take is say, let's go through this process and let's sit down in a meeting. And if it's presented to you and you're like, look, I don't want to do this, I don't need this at that point, then we can at least say, look, we went through the process and we got these specifics put in front of you to be able to look at and say, would this be helpful to me? Versus looking at something in kind of a vacuum. Because when you say, and I think Dr. Bloom hit this very well for the parent side, but it's the same for kids. When you say disability, their mind goes to a certain place. And, a lot of times that place is a severe disability. What we're talking about, kids with severe intellectual disabilities or severe physical disabilities, that's where their brain goes. And to parse this out to them and to say, look, we're not saying anything about you as a person. What we're saying is that you might need some assistance to be able to do better at school. The analogy I like to say is, especially being a short guy, is if something's on the top shelf and I need a ladder, I'm not going to sit there and jump up and down and try to grab something off the top shelf. I'm going to go get a ladder. And it doesn't say anything about me as a person. I'm just trying to make the most efficient use of everything that's available to me. And, 504 plans, IEPs, they're the same thing. They are tools for you to be able to use to be more successful. But ultimately, I think getting them into the process and just saying, at the end of this, if you feel like you still don't want it, you can just say no. You can just say, no, we're not going to implement that. I don't want that. But get them into that process first and say, okay, we'll go through all of this. And then once that's in front of them, there's a very good chance they're going to say, wait, I can get a little bit of extra time on tests. Wait, I can get, half homework. Wait, I can have breaks. I didn't know that this was all that was, yeah, this all sounds great. I can definitely use this.
I think another thing that could help with this too is going back to communication and collaboration, especially with older patients, getting them to participate in what's going to be in the 504 plan, and also asking the patients, like, why do you feel this way about the 504 plan? Having a conversation around what that brings up for them. Maybe it's the term disability, maybe they think that it won't be private. So kind of dispelling some things that might keep them from wanting the 504 plan might be really helpful for them too. So educating and communicating about what it's bringing up for them.
Great. Well, thank you, everybody. We're at our 11:30 time mark. We want to respect everybody's day. And thank you so much to our panel speakers and sponsors and everyone who's joined us and lasted this long. I really hope and pray that your kids have the most fabulous year. We're here to support you. Again, asking if you could please send me any of your plans for our manual. We will be sending out an evaluation, the materials from today, sponsor information, anything else you'd like, just let us know. And thank you. Thank you again. Oh, please wait about 2 weeks for the gift cards. Hope you get some really nice snazzy supplies. Hopefully next year we'll be able to give out all the stuff again. And thank you. So have a great day. Bye, everyone.
Thank you.